69,000 cases today after a spike in COVID-19 cases. Nevada's numbers are continuing to improve, including our daily positivity rate. Now, right now, Nevada is seeing an average of about 460 new cases per day. Just 1 month ago, it was more than 1,000 per day. Officials say the turnaround time for test results is also improving. Paul Nelson has more.
Nevada has seen some pretty big fluctuations in COVID-19 cases and deaths over the last several months. It appears we could end August on a positive note.
The healthcare infrastructure within Nevada remains in good condition, and the downward trajectory of COVID-19 hospitalization continues.
State officials say Nevada is already testing more than what's recommended in our communities. In the past, there were so many samples taken that it created a backup for the labs, causing delays, but officials say even those are getting better.
At the most, we had an average turnaround time of anywhere from 4 to 5 days, and that's now around 2 to 3 days. Granted, it varies based on the lab, especially if it has to be sent to an out-of-state lab.
The CDC says 6% of all COVID-19 deaths in the country did not include underlying health conditions. That goes along with what experts have been saying since the beginning of the pandemic. Officials say the disease was still an underlying factor in those deaths, and health districts have to report them as such.
COVID-19 is one of those things that can speed up the process, the process for people who are already failing and passing away.
Officials say mortality of the coronavirus is still difficult to know for sure. They say determining the cause of death can be tricky, and we still have a lot to learn about the overall impact of